Hello, welcome to Wellbeing. I'm Graham Wilson. You've probably seen people snapping pictures of their meals at restaurants, or maybe you've done it yourself and shared it on social media. But today on the program, we're going to explore a very different use for food photography. It's just one way that scientists can help us improve nutrition and even support efforts to prevent childhood obesity. It's good to have as a guest on the program again today, Professor Tracy Burrows. She's the National Health and Medical Research Council Fellow at the University of Newcastle's School of Health Sciences and recently been honoured as a Fellow of the Australian Academy of Health and Medical Sciences. And she's helping to reshape dietary assessment using cutting-edge digital tools. Tracy, welcome to the program.
Thank you. Thanks for having me.
Can you just go through a little snapshot of your career in the last couple of decades, how you got into nutrition research, first of all, and what attracted you to this field?
Oh, that's a loaded question, I think. That's how much time do we have? No. So I guess it's really interesting because actually when I finished high school, I didn't go naturally straight into nutrition and dietetics. I didn't think that was something that would interest me, and I actually started engineering. But I then kind of worked out that didn't really suit me and swapped over to nutrition and dietetics, and I think it's been a passion kind of ever since I switched sort of degrees. But I guess thinking through some of the things that you were sort of talking about just now, I think everybody knows nutrition is important, but I think when we consider it and we look into it in a lot more detail, there's so much that it can benefit people and help people through different situations, whether that's a medical condition, whether it helps you feel better from a mental health perspective. I think it's something that really drives me, and the ability that we can access food every day and people can kind of change the way that they eat and have an impact on it. That really drives me to continue to do sort of like nutrition research. So I guess maybe you would be helpful if you kind of ask me some of those questions, and then otherwise I'll just keep talking.
No, go ahead. This is good. I mean, I'm interested in how your multidisciplinary approach plays into dietetics. I mean, you mentioned an engineering interest, so you've brought that to nutrition, obviously. Yeah,
well, being a dietitian, sometimes you naturally get asked, oh, what do you do? Do you just kind of cook toast? I remember someone asking me that when I first started out as a clinician, what kind of things do you do? And I think it's always intriguing because sometimes people don't really know how much a dietitian can do for you, perhaps until something goes wrong. So maybe you have a health condition or, something else that's happening in your body. But dietitians are pretty well equipped to take all the biochemistry from your blood to how your body works to so many different things. So, chemistry, maths, engineering, equations, how much does your body need compared to someone else's body, all of those types of things, they all play into what a dietitian does. So I think we're a pretty skilled profession, and I'm pretty proud to be a dietitian. So I think we're more than meets the eye.
So we are what we eat. I mean, that's a very loaded statement, isn't it? Because we hear about lifestyle conditions, and that's probably nearly every condition is a lifestyle condition at its base, isn't it?
Yeah, and I think just going back to what you were saying about multidisciplinary, I guess, or even in the introduction when you were sort of starting to talk, I think that we obviously eat food, and, from an evolution perspective, we have to eat food to survive every day. But there's so many elements about food, like whether it's a social thing, like you were saying, like now a lot of people just Instagram their photos or those things. We eat dinner at the table as a family, or social events like Christmas, or kind of all around food. So there's just so many elements to it. And even when we think about it from a multidisciplinary perspective, so, what a dietitian does, we might be able to think about what someone eats, but it sort of doesn't happen in isolation. It kind of, maybe you slept really bad, so then you wake up and then you might be eating something different to what you would normally eat if you'd had a reasonable night's sleep, or you're too tired because you can't go and do some exercise, so walking or whatever it happens to be that floats people's boats for exercise. But they all roll together, so you can't really change what someone eats without thinking about all the other things that are in their lifestyle. So lots of the work that we do as a dietitian, or that I've done kind of over the many years that I've been a dietitian, have really focused in on bringing that multidisciplinary aspect. So working with exercise physiologists or personal trainers or sleep behaviour or all of those types of things, and thinking about them all together as a holistic package. And I think that's probably one thing that's one of the things that, I've done with research that's quite, I guess, innovative is, look at how food and what we eat, how it impacts how we feel and the mental health perspective. And so bringing actually another discipline into the whole mix of it about psychology has been really, really important work, I think, that has been done sort of more in recent years.
When you talk about a dietary assessment, what do you mean, and how is improving it so critical for public health?
Yeah, yep. So dietary assessment's kind of just a fancy word for finding out what someone actually eats day to day. And I think it's really important for us as a health practitioner to understand how or what someone's eating day to day. Now, it sounds really easy, right? What did you eat yesterday or what did you eat on the weekend? But so many things impact that. And perhaps you don't eat the same during the week as you do on the weekend. So I guess sometimes as a dietitian, you kind of got to work out how you can get that, accurate information out. And, to be honest, who wants to tell the dietitian exactly what you want to eat? So, you don't want to tell them that you might have had, ice cream last night or chocolate or all those types of things. I think people have a preconceived idea that dietitians are, nutrition angels. But, we all live day to day. So it's important for us to find out how to accurately do that. So I think when I first started out doing my PhD, one of the pieces of work that we did was how can we assess dietary intake accurately? So getting the best picture that we can so that we can be of best help to that person. And how could we make it less of a burden? So when I first started out as a dietitian, we might ask someone what they ate. And it can be pretty time consuming because you've got to go through everything from when they woke up first thing in the morning all the way through to when they went to bed, or perhaps they eat during the night as well. So it can take quite a lot of time. So actually doing it properly, making it not hard on the person that you're assessing dietary intake, or not taking the burden away from the clinician as well. I remember when I first started as a dietitian in the hospital, you could ask someone what they were eating, but then I'd have to go away and I wouldn't be able to give them any help until maybe the next time that I saw them. So why dietary intake assessment's really important is that we kind of have used technology to really change that, to make it faster so that we can give people feedback much, much faster, like on-the-spot feedback, rather than waiting days when they're really motivated to make that change. So dietary assessment's pretty important because you've got to get the right information, because if someone doesn't tell you the right information, we can't be as much help as we possibly can be. So does that kind of help answer your question a little bit?
Yeah, I'm interested now then how have the apps and taking pictures of your food, explain how that works. So somebody snaps a picture of their food with an app, is that what happens?
Yeah, so there's all different ways and means that someone can assess a dietary intake, and it can be from a day all the way through to, trying to get a picture over the past 3 months to try and figure out someone's health story. But what we really have used, particularly in my research, but also the broader team at the University of Newcastle, is utilising technology to help break that kind of burden down for both the person, the clinician, and the time it takes to get back. So we started, I could talk about a whole range of different types of projects where we've used technology, but the one that I think that you're sort of starting to allude to is where someone takes a picture and then we can actually use kind of lots of imagery to try and get an idea about the energy kind of that, or the nutrients that might be contained in those foods, rather than having to rely on someone verbally telling me exactly what they ate and telling me that there was sugar or there was, coffee or whatever added to whatever the mixture is that they're doing. So that's, apps and things like that. Sure, everyone can take a picture, but we have to be able to connect that to sort of like a nutritional database so that we can get all of those kind of parts back, rather than just saying, yes, that looks really good, because if you take a picture of, I don't know, what did you have for breakfast? Let's use it as an example. What did you have for breakfast this morning?
Okay, a plate of muesli, some, what was it? It was coconut yogurt and banana and raspberries, yeah?
That sounds pretty good. But, if you take a picture of that, we'd have to be able to, for me to be able to sort of give you some feedback or, nutritional analysis on that. We have to connect that photo, to a big database of different foods, because how many mueslis are there, or how many different types of coconut yogurt, or how much did you have, and all of that type of stuff. Yeah. So the technology has been really able to revolutionise that, to rather than just take a picture, to kind of get a depth image, to see how much the quantity would actually be. But I think most importantly, we've been able to do this in places where they may not have a nutritional database. Like, we're very, very lucky in Australia, but some of the work that we've done is in developing countries like Cambodia and Tanzania, where they don't actually even have a nutritional database. And so we overcame a lot of, language barriers or cognitive barriers or literacy barriers by just utilising the photo rather than having to create different languages or learn how to train people up to do that. So that's just an example of how we've kind of taken something that we've developed locally in a mobile phone app and then translated it and sort of revolutionised this kind of internationally.
Now, that example you brought up in Cambodia, you've been doing a study there where you use image and voice-based dietary assessment?
Yeah, because we kind of need a little bit of the voice to, complement what's in the image. Like, say, for example, if we just use what you were just telling me before, if I just looked at the photo without you telling me, I'd probably be able to identify, that there was some muesli in there and there might be some milk or yogurt, but I probably wouldn't have picked up the little bit of detail around, that it was a coconut yogurt or a low-fat yogurt or, the intricacies of it. And when you take something international and a total different food system, some of those kind of components like that people might be preparing at home, like you might have a dish. I mean, at our house, spaghetti bolognese is pretty common, but, my version of spaghetti bolognese is probably different to the neighbours and different to a lot of other families.
Yeah.
And so internationally, they could have these, staple type foods, but we need the voice to be able to connect to the image. So, we've just utilised that kind of capability that people can do on their phone just in that initial assessment so that we could get an idea about what people generally have in their, traditional dishes.
What was the research question you set out to answer in Cambodia?
Oh, the research question was all different, but we essentially were trying to set up how we could, assess people's dietary intake in those countries. They have a very different, health conditions that affect their population. So that cornerstone piece that we started talking about before around dietary assessment, it's pivotal in Australia, it's pivotal everywhere in the world, but if you haven't got any skilled clinicians or we were really trying to build kind of capacity in those countries to assess dietary intake so that then they could make some more informed decisions about how they could improve their dietary intake, because kind of circles back to that whole thing again, thinking about that what we eat actually influences everything in our body and, the importance of that.
Can you just walk us through how that works in practice, what the participants experience? They've got an app on their phone for a start, I guess.
Mm-hmm. So the participants in the study, it initially started in Australia because we had to get kind of like a few versions of that app in English to start with to make sure that we could make it work before we could then translate it into the local languages in those countries. But what we essentially did, instead of me, as a dietitian, what I would do if someone came to see me in clinic, I would ask them the questions verbally, what did you have yesterday, and then get some of those kind of more intricate details and what's their health story and things like that. But what we did was we installed the app on the people's phone and it would be kind of like very intuitive, with different kind of push buttons and things like that. And we'd train them up just to kind of give them an idea about how to assess their dietary intake. But we ran into a little bit of a problem in Cambodia and Tanzania in that they actually didn't have a dietary database so even if we found out what they were eating, there's no way we could work out what their analysis would be. So the project turned into a much bigger project than we initially started with because we had to then manually build a database for a couple of countries. So it was a huge team effort to get that kind of happening. So we needed that kind of piece of the puzzle because otherwise if someone took the picture on their phone, we wouldn't be able to analyse it anyway, so it was going to be pointless. So we had to kind of build all of the different kind of components of nutrition assessment into that app. We had people checking what that food was. We had local people. We had some amazing research students, so PhD students who were working on that Cambodian project. And a lot of people, bringing back that multidisciplinary perspective, we utilised and created a lot of really great relationships with technology partners to enable that to be a seamless kind of experience for the participants, so that all they had to do was take the picture and record actually what it was or how they were cooking it, and then that data would come to us. It would be uploaded to a cloud, and then we'd be able to connect it to the system. But I'm making probably it sound very, very simple, but it was a very complicated and complex project to do that.
And I guess to make it worthwhile, you need to know about the health status of the person who's eating that food, yeah?
Yeah, definitely. So I guess initially with the project, the question was really to develop that dietary assessment tool and to create the capacity for people to be able to then utilise that kind of app. So, so that, I mean, it was a very rewarding project, building that app. But again, the cornerstone of dietary assessment, I mean, you could talk to a lot of dietitians and they probably wouldn't get as excited as I do about dietary assessment because it's pretty mundane, asking people questions and things like that. But to me, that was kind of a challenge. I really wanted to make it easier for people. And even some of the tools that we have available online, like the Australian Eating Survey is a really good example, or the Healthy Eating Quiz. The Healthy Eating Quiz is free online. People can complete it. It's a couple of, it might be 70 questions, and you can get dietary feedback instantaneously. And that's something that, 10, 15 years ago would have taken 2 or 3 days to enable that to happen. So, that example with the app is just one example, but, technology has been the thing that's really harnessed and leveraged, in a lot of our projects that we've then been able to apply to lots of different populations. So I guess, if you need a person there to do that dietary assessment, that's one thing. But when I've got a client who perhaps is located rurally and I want to assess their dietary intake, they could complete it before I even talk to them, so that then if they've only got 20 minutes of their time, I can really make the most of that time and give them that straight feedback. And they've been able to do that, without even seeing me. So, we've been able to apply it in lots of different research studies and, be able to recruit from across Australia rather than just locally in Newcastle because we don't need them to see that person.
Right. That website then, healthyeatingquiz.com.au, that's the one, isn't it?
Yeah, and you can actually access it from an even better website called No Money, No Time, and it's got it'll connect someone to a dashboard and provide budget-friendly recipes, and you can put in preferences and motivators and things. So probably No Money, No Time is a better one for people to go to if they're interested, and they can access that healthy eating quiz from there.
Okay, we've had Professor Claire Collins on the show talking about that one. No Money, No Time. So
yeah, definitely.
Memorable website. Today on Wellbeing, I'm talking with Professor Tracy Burrows about her award-winning work using digital tools to better understand diet and improve child health outcomes. Tracy, your work's informed child obesity interventions and clinical guidelines. How do you ensure that the measurement improvements translate into better interventions and not just better data?
Yeah, so that's a good question. And I guess it's a good example is childhood obesity, but I guess that's probably just one example because that one's a little bit more historical. That was kind of the child obesity intervention was really thinking about how we could utilise families, because it's not the children making the decisions in those households. It was talking to parents and families about that. But I guess the real thing to kind of that's really interesting, I think, to talk about is those intervention components. Once we've got that information from the dietary assessment, we can then kind of create better digital interventions. So connecting with people online via telehealth. Now, that's probably something that listeners are probably going, yeah, we've heard about that. But from a historical perspective, in the field of sort of nutrition and dietetics research, those telehealth interventions, they've revolutionised that ability to kind of increase the access and reach of services. Back in when we were doing the child obesity interventions, that was all face-to-face, getting people to come into the university. It's very labour-intensive. And now these interventions that we've got in child obesity or mental health or food addiction, they all can be delivered online so that people can access it when they want it. And that's, really pivotal, I think, because it means, again, going back to technology, we can take information as it comes out in research and really distribute it or give it to the people who need it in a much quicker time frame than what's ever been done in the past. It might take a long time for a dietitian to rewrite a manual for the face-to-face kind of sessions for a group program, but once we kind of can get it online, that's really enabled things. And I think that's really important to think about because, even in different types of conditions, people have to travel long distances to access specialised services. You know, in Newcastle, we're lucky that we've got a really great, health service located close by, but that's not the same for everybody. So that kind of increasing that kind of access to services has been something that's driven me to create better treatments for people, whether it's child obesity interventions or, mental health or any of those types of things. So, yeah.
When you work across diverse populations, including low and middle income earners in various countries, what are the key factors to making interventions both culturally appropriate and evidence-based?
So I think it's it's a very good balance between thinking about what the evidence is telling you, but then also talking to people with lived experience, so the consumers. So whether that is a culturally, linguistically diverse population or whether that's someone with the condition who can give you the hands-on experience, the ability to combine those two together is pivotal because we want to, I've seen it happen before. People create these amazing interventions in whether it's research or practice in dietetics or in other different fields, and then they're like, well, why does no one use it? They haven't talked to the people who really want to use it. So I think it's really having that kind of first-hand experience throughout that whole development, rollout and scale-out kind of project. So, research usually happens, you start with something small, a little bit of an idea, gain a little bit of knowledge, and then you might build what they call a pilot. So you do like a small study and then you might tweak it or change it type thing to make it better. And then if you're lucky enough to be able to then scale it out to make more people be able to access it, having someone with a lived experience along that whole journey or a group of people is even better so that then you can combine it with the evidence. And that's the beauty of kind of doing research as a health practitioner, being able to have those skills to be able to pull all of that together. That's been pivotal in, if I think about the work around food addiction, the notion that someone could be even addicted to food, that was very challenging in the first instance and kind of challenging people's ideas. And then it's created a whole multidisciplinary area of research where what we eat does make you feel different and, makes you feel better or it makes you feel worse, whichever it is. And then how that can impact broader mental health like depression and anxiety. But that whole piece of work started with a little bit of an idea, a little pilot study, and then kind of moved up into these kind of bigger, larger type of trials. But what I was going to say is that the consumer, the person with the lived experience of food addiction or addictive eating or binge eating, for example, they were so pivotal in helping us put that program together. They told us, yep, that's great, but yeah, I hate that part. Or yes, I like that part. Could you make that a picture rather than words? So that then when we get to the actual program, people go, oh, that was amazing. I loved it. So it's kind of that dual kind of component, I think, of having that lived experience and then having the evidence part.
We could talk about some of the common barriers to improving diet quality that persist across populations, but rather than the barriers, what are the things that people want? What are they asking for? Well,
I think if we're talking pretty generally about that, we can talk about, people on, just the cost of living in general, I think is one thing that we can think about because it doesn't affect one person. We're all challenged by increasing prices and things like that, or the challenge that perhaps, some healthier foods in some places or different types of foods perhaps are more expensive and things like that. I think everybody would really like to eat healthy and they know that they should, but then all these other challenges come in, where do you live, what's happening in that person's life and things like that. So I think budget, eating healthy on a budget is usually something that comes up. And that No Money, No Time website definitely has that built in because the consumers told us that's something that they definitely want. So all of the recipes and things like that, they can all be filtered on budget. So I think that's one thing that's, I don't know anybody actually in kind of our family or, broader community and things like that who doesn't think about money and things like that when it comes to food. So.
No Money, No Time, that website itself is an e-health tool as such. Yeah, okay.
Yeah, definitely.
So looking ahead, what do you see as the next frontier in dietary assessment and diet quality research that your team is going to get into?
Now, I don't think it's necessarily what's the next frontier in dietary assessment, because I feel like we've got quite a lot of tools now, whether they're short tools or longer tools or clinical grade tools that have really, hit the mark in a lot of places. So I think it's really about applying all of that knowledge and kind of skill, I think, to different areas. And I think that, we do know a lot about nutrition and the food that we eat, but it's actually like if you think about it, or if I think about it and compare it to, say, other areas of research, nutrition and dietetics research is still quite young. And so I feel like some of those kind of things that we've learned about dietary assessment and applying that to different population groups so that we can find out a little bit more about what people are actually eating, that's how I think the next kind of, that kind of drives me, because I think about it in the context of, I started out thinking about food addiction, but then I thought, okay, well, what about depression? What about anxiety? And as I looked into the research, it was really surprising that there's not a lot there. And so if we can apply those dietary assessment tools to these population groups, imagine if I could, instead of someone having to get, antidepressant medication, I could say, let's have this type of food and let's have this type of dietary intake. And even in some of the other kind of areas and things like that, like oncology and cancer research, like there's a lot that we can do in that space as well for cancer survivors. So I think it's applying what we already know in these dietary assessment measures that we've now got a really strong foundation. We can leverage that and apply it across different population groups, because if we go back to the start, if we know exactly what people are eating, we know how we can modify it or change it to improve the health outcome. And that's exciting.
Could the digital voice imaging tools be integrated into routine healthcare?
Yeah, definitely. I think we just have to know that people are how they're going to use it, and make sure it kind of stays up to date. Because technology. If everyone thinks about technology, it changes every day. So we just have to make sure we keep it kind of up to date, and that the people who are going to use it know how to apply it, I think.
Mm-hmm. And finally, after years of studying diet and technology and behaviour,
mm-hmm.
how has your own diet or how you think about food changed?
Oh, yeah, well, it's changed. I was always kind of interested in what people, or what I eat, like what people eat and how it can kind of drive different things. But I think I've kind of, personally experienced, like when I was working clinically in private practice, it'd be really interesting because you'd be able to say to someone, oh, I think you should, modify this, or these are some suggested changes. And then they'd come back a couple of years later and you're like, hang on, I think I've seen you before. And, just as life progresses, different health conditions emerge in people's lives. So I think that people's focus kind of changes, and there's different phases and fads around nutrition and diet. But, I can personally say that, I've always been interested in what I eat, but even with different health conditions that have emerged for me personally recently, very much plays into what I eat. And I definitely, has changed, So sometimes I might not have previously thought about protein, or I might have previously not thought too much about, fibre or all those types of things. And now, they're front and centre in most people's minds. But when you've got a health condition where you think, okay, yep, we've definitely got to, not beef it up, but, increase the quantity or increase the quality. Yeah, definitely. I think it's like a personal challenge, really.
All right. Well, all the best. And thank you for talking to us today, Tracy.
No worries. Thanks for having me on.
Much appreciated. Tracy Burrows, National Health and Medical Research Council Fellow in the University of Newcastle's School of Health Sciences. That website again, if you want to follow up and get some more advice on what to eat and take that assessment test that Tracy was talking about earlier, nomoneyNoTime.com.au is the website. I'm Graham Wilson. Thanks for listening, and all of us at Wellbeing wish you well.